Let's talk about projections, data, what's coming out of the University of Washington and other places. The UW model that was released this week says that deaths will continue to rise across the country to over 134,000 by August, yet the same data suggests the rate of infection has slowed, particularly here in Seattle. What do you make of the data that's in front of us right now?
So I think there's what people need to understand. The really most important thing is that flattening the curve was the first goal. And we did that so that the number of people being sick and presenting in the hospital wouldn't overwhelm the hospital system. And because people have stayed home and done what we asked them to do, we were able to do that. But we still have a long ways to go to be anywhere out of the woods. And if you look at the metrics we need to reopen, we want to make sure that we don't become what happened in New York or what happened in Italy or Spain or Portugal and have the virus take off again and have to shut Seattle down. So while we have done a good job of curbing the transmission, we went from almost 3, which is for every person who had the virus, they gave it to 3 people, to less than 1, which is exactly where we need to be. Now we just got to make sure as people come together more, the virus doesn't increase to a point where it runs out of control.
It's one of those cup half full, half empty things, though, because the numbers that you just put out there, some people will hear that and say, well, that means we should start opening back up. We should open up restaurants or allow them to at least be partially open and open up retail establishments. Why not?
So we are in, for 2 months, we have been pretty much shut down. We've had necessary businesses like grocery stores and pharmacies and some construction sites open, but for the most part, everything closed down. And we're still seeing hundreds of new cases every day across Washington state and dozens of new cases in King County. So that tells us even when we're apart, this virus is finding a way to get people sick. As soon as you start bringing people together again, the virus just has more targets, and it will keep duplicating as quickly as it can. And so we have to open it up, bring people together, and then it takes about 2 weeks to see what impact that has because of from infection to showing symptoms. That's about how long. So 3 weeks is how the governor's pegged it to really measure how we're doing. Because there's nobody I talk to that wants to go back to that first days when we had the prospect of just thousands of people getting sick, hundreds of people dying. We not only want to beat the curve, we want to beat the virus.
Why not go to do what California is going to do by the end of this week? Go to phase 2, allow for some retail establishments to open up, certain types of shops to open up. Why are we not in Washington State and in Seattle in the same position that California's in?
So first, I think that California is being a little bit more paused than people think they are, because they're looking at those metrics true and trying to decide whether geographically there's some places that are ready. But if you look at Governor Newsom's grid in California, it's very similar to what Governor Inslee said, and the same as in Ohio and New York. There's a bunch of metrics that we have to hit before we can reopen. And I think that we are very similar to California, although actually our reduction rate and our place in the curve is better than the larger areas in like Los Angeles and San Francisco.
So what, as the mayor of the biggest city in Washington State, what metrics do you want to see before, say, there's a loosening of the restrictions?
So there's both, where are we in terms of fighting the virus? So we want to make sure we keep that downward trajectory for at least 2 weeks, which is the CDC recommendation, 3 weeks, which is where some of the experts think we need to be. We also want to get to some low number that we have of new cases every day on a 3-day rolling average, because that will tell us how quickly the virus is growing. We want to, so that's just kind of what's happened in the virus itself. I think we've gotten to the point where we've got the capacity in our hospital system, but as you reopen, you want to look at that so you know you're not overrunning the hospital system. And then the key metric we have to hit before we open up broadly is we have to make sure that we have enough testing and enough contact tracing. It is because we did not know that the virus was spreading in Seattle and King County in January and early February. it was able to get to community spread, and we were left with very few options other than to shut down. We don't want that to happen again. The only tools we have to kind of see what's happening and to modulate where we are in the dial is testing, 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 and contact tracing. Get people quickly who have it, isolate them so they can't give it to other people. And we do not have that capability yet. The governor's building for it, King County and Seattle are having discussions to make sure that we're ready. We are not ready yet. And if we were just to open up today, there is no question what would happen. The virus would spread. It would probably spread uncontrollably. Our hospital system could be overrun, and we'd have to start shutting down again.
You and I both know it's going to be a hot weekend, 80 degrees, Mother's Day weekend. People are going to want to rush out to Alki Beach or the Arboretum or Volunteer Park, Discovery Park. What do you want to say to the people who are like, hey, the data shows that the curve's been flattening. Why not go to the park?
So first, I understand that. I mean, I grew up here, and these beautiful May days are what we wait for almost all year. And it's going to be gorgeous. We want people to be able to get outside. It's why our parks are going to remain open, because we think it's important for sanity reasons, and it's part of who we are. But we haven't beaten this virus, and we have to be smart. We don't want to be like some of the folks we've seen on TV who gather by the thousands at the beach, and 2 weeks later, many of them have the virus. The virus is still here. It is waiting for people to come together so more people can get sick. So we need people to keep moving. No picnics, no barbecues, no sitting on the beach for hours or having groups or gatherings. The rules are still in place. And you've worked so hard, let's not go backwards. This is National Appreciate Nurses Day. And we got to remember what those nurses and other healthcare workers have been through in the last 2 months. You know, they have not only put their own lives on the line, working hundreds of hours and seeing so many patients that they couldn't help. Let's not go back there. Be smart, be safe, stay home. But if you need to get out, enjoy the day. But don't, keep moving because crowded parks will become closed parks.
Will there be extra parks employees or police going around and telling people to stay away from each other?
So we'll have our park ambassadors there to remind people, and our police regularly patrol in these areas. But look, each of us is the enforcement. We're the ones who have to take the responsible action, and the people we're with have to be responsible. This shouldn't be a job for someone else to tell us what to do. We know what to do, and Seattle shows that it can be smart and act smart and take care of each other. And the way we take care of each other right now is not to come together. There'll be time for that, and we are going to have some amazing gatherings and parties when we get through this. But right now, for Seattle to continue the good work, you got to stay home as much as possible. If you need to get outside and want to enjoy this beautiful weather, totally understood. Everyone wants to be able to do that, and you can do it. But we just can't do the barbecues, gatherings. Keep moving, take the walk, get back home.
I just want to touch on a couple of other things real quick. You and I have talked the last couple of weeks about what would normally, in a normal environment, be the biggest issue in the city right now. That's the West Seattle Bridge. As you also know, SDOT's done a bit in the past week. There have been meetings in West Seattle. Where does the city stand, though, in actually having a plan, a price tag, a timeline for a replacement plan for the West Seattle Bridge?
We're closer, but we're not there yet. I get briefed on it multiple times a week. I was briefed yesterday. We want to make sure that when we go to the public, a couple things are true, that they see the transparency in what we're doing and why we're doing. And the thing I want to make really clear to people is we are doing all paths at the same time. We're not going to do all the testing that's necessary to, can we do repair? And only if we decide, can we do repair, then do we start thinking about replacement. We're going to start making those plans at the same time. Where we're at right now is they are going to continue putting up the instruments they have to have in place to see how much the bridge is moving. The cracks continue to grow, and they can continue to grow despite the fact that there's not been any traffic on that bridge for a very long time now. So we need that instrumentation to tell us exactly what the rate is and that will tell us and inform us as to whether repair is possible. The first thing they're going to do is take out that bearing that is between the bridge and one of the pillars that they think is getting stuck on it, for lack of a better description, and see if that frees up enough of the tension that then we know that the bridge can be repaired and be of some use for the longer term. If it doesn't, then we're going to come back and probably calculate, does that mean that we need to replace? So we're going to have budgets and projections on how long will it take to fix it and repair it, how long, and what would it look like if we're replacing it.
So is there a scenario where you wouldn't necessarily need to replace the entire 2,000 plus foot span, that perhaps it would just be a smaller portion?
I don't think that's in the cards, but I don't think they've finished reviewing those possibilities. And I've urged for us to look at the range, but also look at what are the new building techniques that are in place for expedited bridge construction. As we talked about before, we have 2 people at the University of Washington who've specialized looking at that kind of construction. So we're going to be looking at both short-term repair, longer-term repair, replacement, and every type of replacement that might be possible. The preliminary, I think, conclusion of people so far is if you have to replace, you probably have to replace at least the whole span. And then that gets us into, if we're going to be building a second bridge for Sound Transit, doesn't it make sense that you would do that at the same time? So it would be more cost efficient, and more service to the people of Seattle.